Well, to shed more light on the President Abdel Fattah al-Sisi attending today and inaugurating the Health, Population and Development platform today that is going to held annually, we have the pleasure to have this phone with Dr. May al-Batran, economic expert. Good afternoon. Hello.
Yes, hi.
Hello. Dr. Batran, how do you see the importance of Egypt's organizing the first health and population and development platform today?
The importance of relating health and development is extremely, of highlighting the health and development is extremely important. Egypt has worked extremely high in the past 8 years to reach development level and to enhance the infrastructure and to enhance the life of its individuals. And as such, relating health as a main component of development is extremely important. Making sure that the health of the Egyptian population and the number of the Egyptian population and the growth of the Egyptian population, they all interact together as to collectively help enhance our lives collectively as Egyptian people, and to have a better impact of the future, better chances of work and job opportunities, and the fact that the political leadership enhanced the unemployment and unemployment figures, and how much the fight of or the building of the sustainability and sustainability enhancement in the past few years helped create jobs, and in order to maintain the jobs and to maintain the number of jobs, we collectively have to work together, not only the state, but the state has started and it kicked off this development initiative extremely strongly the past few years, and now this is the time to work together as Egyptian people to work together to maintain our health, to maintain the number of our families initially, each and every one in planning for their future, young people in planning for their future. They should plan for a child or two, or depending on their abilities, to give them the best they can. And this maintains a living standards for the small family and ultimately for the population of Egypt.
Yes, Dr. Batran, how do you see the importance of this conference as the first edition of the Health and Population and Development Conference to be held, that is going to be held annually? How do you see the importance of the first edition in putting a plan for the coming years?
The fact that the country now has been taking initiatives and creating a direct platform to talk to its people and to talk to the world and to say where we are, what is our plan, and we'll meet annually to see the performance. So it's a way to maintain performance in a very highly publicized way, in a direct message for the people of Egypt, telling them this is where we are, this is where we're going to be, this is what we've done, this is what we're aiming to do. But this is a very interesting point regarding transparency and governance, and this creates a very important balance and the route of communication between the government and the people of Egypt, and the people of Egypt and its governments and the world. So this is a message of, and something else, we as normal Egyptians, when we talk among each other, we talk basically about the about health and education and how important they are to our future as a country.
Yes,
and this is a listening of the government to its people and answering back by creating health initiatives, creating successes in health, creating job opportunities for the young population, and maintaining the communication platform again. So it's a very interesting point. It's a very important step from the point of view of bettering Egyptian health and bettering Egyptian life, and communicating with locally and internationally.
Yes. So, Dr. Batran, the conference has 65 interactive sessions with the participation of more than 270 speakers from around the world. So, what are the most important topics of these sessions?
The topics in general, the population growth, the health of the Egyptians, particular diseases that is affecting Egyptian population currently and the future. This is very important. And the technology and the impact of technology on the future of health from the point of view prevention, from the point of view management, and from the point of view sustainability of the health of the population. These are all very important topics. And we have seen the success, based on the success that we have seen of the coronavirus pandemic management, how the Egyptian government maintained the health of Egyptian people, looked into the possibility and future needs of the potential sickness and sick people and the numbers, and creating the infrastructure required. And Egypt not only has managed the process very successfully, but also it created an infrastructure that thankfully was not used. And this maintains the importance of, and it highlights the importance of life to the Egyptian government and to the Egyptian states, and then how do we take care of the future. So the topics that they are covered, they are success stories from the world, they are prevention and governance of the future, and strategic plans and partners for the future. So it's a very, very interactive conference, a lot of interesting data being transferred and successes shared, and it just gives a lot of hope to us people working in the health sector. And as a health economist, I am very impressed by the discussions taking place, and the value that the Egyptian government and the Egyptian state is putting on its people, on its population, and on its and bettering their future.
Yes, Dr. Batran, why is the overpopulation now a very big problem facing Egypt and facing other countries around the world? Yet, through the history, the population was a kind of a national treasure for any country. If this country faces, for example, a war or something, there would be people to fight for the country. So give us an idea about this, please.
The population, the number of population of any country, it's a sword with two blades. It's got its positives and its negatives. The positive fact is the force, the brain power.
Sorry, Doctor, sorry to cut you off, but we are going to a short break because we are going to have the call for the afternoon prayers, and we'll be back to continue our interview with you.